Hello friends, welcome once again to the lecture number 41 of your course Pharmacology-II BP 503T Unit 5. In our earlier lectures we have talked about the pharmacology of androgens, male sex hormone, estrogen, progestins and oral contraceptive agents. In this lecture we will be talking about the drugs which act on uterus. I am Dr. Monica Sachdeva, Principal and Professor at Rajkumar Goyal Institute of Technology, Department of Pharmacy. So, let us start with it. So, we will be talking about the drugs which act on uterus. We have already seen the female sex hormones, the estrogen and the progesterone, what is their mechanism of action and how they act. We now talk about the drugs which act on the uterus. Now, these drugs which act on the uterus, they can either act on the endometrium or they can also act on the myometrium of the uterus. Now, in endometrium, estrogens can act, progestins can also have their effect, and also their antagonists, they can produce their effects on the endometrium. And this myometrium, you know that it has got parasympathetic as well as the sympathetic innervation. So, this myometrium can affect the motility the motility of these myometrium can be affected by the autonomic drugs. So, these drugs which act on uterus, we divide it into two basic types. One are the drugs which stimulate the uterus, we call them as uterine stimulants, or they are called as the oxytocics. Fine. So, the drugs which stimulate the uterus, they are called as the oxytocics, and another class of the drug is there which we call as the uterine relaxants, that is the drugs which relax the uterus, जो contractions को कम करता है, they are called as the tocolytics. Fine. So, we have two classes of the drugs, uterine stimulants जो कि uterus की contractions को stimulate करता है, we call them as oxytocics, and second class of drugs which are uterine relaxants जो contractions को relax करता है, they are called as the uterine relaxants, or we call them as the tocolytic drugs. Now, these oxytocics, we will be first talking about uterine stimulants or the oxytocic drugs. These oxytocic drugs, they can be classified as the posterior pituitary hormone, which is oxytocin, ergot alkaloids, ergometrine and methyl ergometrine, then prostaglandins, prostaglandin E2, dinoprostone, dinoprost, and certain other miscellaneous drugs, ethacridine or quinine. And then there are uterine relaxant drugs which we call as tocolytics. They are adrenergic agonist drugs like ritodrine, then calcium channel blockers like nifedipine, oxytocin antagonist like atosiban, and certain other miscellaneous drugs like magnesium sulfate, progesterone, etc. So, let us first start with the uterine stimulant drugs which we call as oxytocics, and the first drug we will be talking about is the oxytocin. So, what are these uterine stimulants? As we again talked about, इनका काम क्या है यूट्रीन स्टिमुलेंट्स का या ऑक्सीटोसिक्स का? ये इंक्रीज करते हैं यूट्रीन की मोटिलिटी को, स्पेशली एट टर्म. टर्म का मतलब है जब भी बेबी का बर्थ है, डिलीवरी है, वहाँ पर ये जो ड्रग्स हैं ये यूट्रीन मोटिलिटी को इंक्रीज करते हैं. नाउ दिस oxytocin, we know that it is a hormone which is secreted by the posterior pituitary, and these drugs, they are synthesized both within the supraoptic nucleus as well as in the paraventricular nucleus in the hypothalamus, and they are then through these axons, both the axons, they come into this hypothalophyseal tract se, they come into this posterior pituitary, and they are stored in the secretory granules as the oxytocin neurophysin complex, and they are stored here. और stimulus क्या है इसके release का? They are released, this oxytocin is released whenever there is a distension of the cervix, whenever there is distension of vagina, or whenever the baby suckles the milk, that is, at those cases oxytocin release is stimulated. Now, what are the actions of this oxytocin? Main action is on uterus, that is, it increases the force and frequency of the uterine contractions so that the birth of a baby can take place. Now, what is the mechanism of action? This oxytocin that acts through a G protein coupled receptors. The second messenger is the phosphatidyl IP3-DAG pathway, and also through the calcium, which act as a second messenger. Calcium release होगा, IP3-DAG release होगा, and it contracts the uterine smooth muscles. Fine. So there is an influx of calcium, और जब we know that जब भी calcium release होता है, then the sarcoplasmic reticulum और ज़्यादा calcium को release करेगा. जितना ज़्यादा calcium release होगा, we know actin myosin filaments जो हैं activate होंगी, and they will cause the contraction. So that is how the uterine contractions through oxytocin they take place. Now, there are certain other pharmacological actions also of uterine, apart from its action on uterus. They can also act on the breast tissue or the mammary gland. They act on the myoepithelium, and it also forces the milk into the milk sinusoids, which is called as the milk ejection reflex. Then it is also acting on the cardiovascular system. The doses which we use in the obstetrics or during the parturition, that have no effect on the blood pressure, but if higher doses of oxytocin are used, it can lead to vasodilation. Blood vessels dilate हो जाएंगी. जब dilate होंगी, resistance कम होगा, so that will lead to brief fall in blood pressure. There will be जब fall होगा, that leads to reflex tachycardia, increased heart rate, and that will lead to flushing. Then kidneys पे भी act करते हैं. They have antidiuretic hormone like action, that is, they lead to decrease in the urine output. Fine, and can lead to pulmonary edema. अगर बहुत ज़्यादा amount of IV fluids हम देंगे, then that can lead to pulmonary edema. While the normal doses which are used in obstetrics, that has got no effect. Now, what is the physiological role of this oxytocin? As we just talked about in the pharmacological actions, main role in the labor. Labor means that is to induce the labor pains for the delivery of a baby. Then also in case of the milk ejection reflex, because we just saw that whenever there is a suckling reflex, that will stimulate the pituitary to release oxytocin. Then it is also acts as a neurotransmitter. It acts as a peptide neurotransmitter of certain oxytonergic neurons in the hypothalamus as well as in the brain. So, what are the physiological roles? They induce labor, they have a milk ejection reflex, and suckling It stimulates the release of oxytocin from the pituitary, and it also acts as a peptide neurotransmitter. Now, what are the pharmacokinetics? We know that this is again inactive orally, again by the first pass metabolism, so cannot be given by oral route, generally administered by intramuscular or intravenous route, and not given by intranasal spray. It gets rapidly degraded in liver as well as by the kidney. It has got a T-half, very short T-half of only 6 to 12 minutes, and pregnant uterus and placenta, they have a aminopeptidase, वहाँ पर एक aminopeptidase present है which is called as oxytocinase, जो कि इसको जब birth हो जाता है ऑक्सीटोसिन को break down कर देता है. Fine. So 1 unit of oxytocin that consists of this preparation is available as units. So 1 unit जो है oxytocin का, that consists of 2 micrograms of pure hormone. Now, what are the uses of oxytocin? Now, the uses of oxytocin, the main is again it is used in induction of labor. Oxytocin, it is given by a very slow IV infusion. 5 units IU is diluted with 500 ml of glucose or the saline solution, and total about 2 to 4 IU is needed. Then when the uterine contractions, they are very light and the labor is not progressing satisfactorily, we use this drug to to increase the normally progressing labor, so that the contractions are improved. Then this is called as uterine inertia. Then during cesarean section, it is used in case of postpartum hemorrhage, where there can lead to blood loss. During cesarean section, if there is hemorrhage, oxytocin can be injected by intramuscular or by intravenous route for immediate response. Then it can the oxytocin, whenever there is a breast engorgement due to the inefficient milk ejection reflex, then this oxytocin by intranasal spray, if given a few minutes before suckling, it increases the milk production. It does not increase the milk production, but it acts on the breast tissue. Then so the uses are, main uses are in case of it causes induction of labor. Whenever the uterine contractions are very light, to increase those contractions, this is used. And in case of postpartum hemorrhage, in case of cesarean, where there is a blood loss, oxytocin can be administered. Then adverse effect of oxytocin, if there is an injudicious use of oxytocin, large doses for a larger period of time, oxytocin is used, that it can lead to very strong uterine contractions, and it can force the presenting part through incompletely dilated birth canal. It can lead to maternal and also the fetal soft tissue injury. It can lead to rupture of the uterus, and it can lead to asphyxia of the fetus, and it may lead to death. So the oxytocin in the required doses is to be administered so that the proper contractions, uterine contractions, are induced. Then it may also lead to water intoxication, because it has got anti-diuretic hormone like action. So large doses, if they are given along with the IV fluids also, it can lead to toxemia of the pregnancy, and it can lead to renal insufficiency. It can be sometimes very fatal also. So this was about oxytocin. Then the next class of the drug uterine stimulants, they are the ergot alkaloids. We know that they are the alkaloids of the Claviceps purpurea that grow on the rye or wheat grains and some other grains. Only 2 ergot alkaloids, they are used for this purpose as uterine stimulants. They are ergometrine and methyl ergometrine. So, what are the drugs? Ergometrine and the methyl ergometrine. The pharmacological actions, they can be on uterus, it can be on the cardiovascular system, and it could be on the GI tract, gastrointestinal tract. On uterus, they increase the force, also the frequency and the duration of the uterine contractions, and the gravid uterus is more sensitive. Then cardiovascular system, they are very weak vasoconstrictors than ergotamine. They have very low propensity to cause the endothelial damage. So, they can act on cardiovascular system also, but very weak vasoconstrictor activity. Then on gastrointestinal tract, if higher doses are given, it can lead to increase in the peristalsis of the GI tract. Now, coming to the kinetic properties, these drugs, they are nearly completely absorbed if given by the oral route, and onset of action if given by oral route is 15 minutes, by intramuscular route it is 5 minutes, and by intravenous it is, for immediate effect we give the intravenous route. Partially metabolized in liver, excreted in urine, plasma T-half is only about 1 to 2 hours, and the effect of a single dose, it lasts for about 3 to 4 hours. Then what are the uses? Now, the uses of this ergot alkaloids, that is to prevent the postpartum hemorrhage, so that the blood loss does not take place during the cesarean section. This is ergot alkaloids are used by intramuscular route, and they reduce the blood loss. Then to prevent the atony, that is so that the tone of the uterus is maintained after the cesarean section, alkaloids could be given, and also to ensure the normal involution after the birth of the baby, the uterus comes back to the normal, which we call it as the involution. So, to have that normal involution, ergot alkaloids are sometimes given for 7 days. Then adverse effect, very occasionally it can lead to nausea, vomiting and the rise in BP because of its vasoconstrictor activity. It can also lead to inhibition of prolactin release, which acts by its dopaminergic action. Then this drug should not be given, totally contraindicated in patients with vascular disease, in case of hypertension because of its vasoconstrictor effect. If there is any gangrene, again because of the vasoconstrictor effect, blood flow will be reduced. So, it can lead to further worsening of the sepsis or gangrene. It should not be used, and it should not be used during pregnancy and during labor. It should not be used. Then the other class of drugs, they are prostaglandins. These prostaglandins, prostaglandin E2, F2, 2-alpha, they are all very potent uterine stimulants, especially in the later part of the pregnancy, and they cause the ripening of the cervix so that the labor could be induced, the contractions could be induced. So, these drugs, they are used because they induce very strong contractions of the uterus. They are used in case of therapeutic abortion, in case of second trimester pregnancy termination when it is required. Gemiprost is the drug which is used vaginally as pessaries. This drug is used. Or it is another drug, misoprostol, in combination with mifepristone, antiprogestin, that can also be given. Then it is also used in case of cervical priming, in case of postpartum hemorrhage, and it can also be used in case of to induce and to increase the labor. And labor means to increase the contractions of the uterus. It can be used. Carbopost by IM route, it could be given. This drug carbopost, it can be given by intramuscular route. So this was about the uterine stimulants. We now come to the drugs which are called as uterine relaxants, or we call as the tocolytic drugs. So just opposite of the uterine stimulants, these are the drugs which decrease the uterine motility. Stimulants, they were increasing uterine contractions. These are the drugs which decrease the uterine motility or the contractions. So these are the drugs which are used to delay or to postpone the labor, then to delay or to arrest the threatened abortion. जहाँ पर threatened abortion के cases हैं, वहाँ पर these drugs could be used. ठीक है? So stimulants we were using to induce labor. Here we are using the drugs to arrest or to prevent the early labor. और जहाँ पर threatened abortion के cases हैं, abortion के chances है, वहाँ पर उसको reduce कर रहे हैं. Fine. So these drugs, tocolytics, they should not be used if the membrane has already been ruptured, there is a case of hemorrhage, there is a toxemia of pregnancy, or there is an intrauterine infection, then these drugs should not be used. And the classes of the drugs which we use are the adrenergic agonist, calcium channel blockers, we saw it earlier also, then the oxytocin antagonist, magnesium sulfate, and certain miscellaneous drugs which we talked about. Now these beta-2 adrenergic agonist, what is the mechanism? These drugs, they bind to the beta-2 receptor which is present on the myometrium, beta-2 adrenergic receptor, activate adenyl cyclic activity, increase in CAMP activity, there is decrease in the calcium concentration. जब calcium concentration decrease करेगा, that will lead to relaxation. So that is how these drugs, the beta-2 adrenergic agonists, are used as the uterine relaxants. And the drugs which we use, they are the ritodrine, isoxaprine, salbutamol, and terbutaline. But these two drugs, ritodrine and isoxaprine, they are specifically, these drugs, they are developed as the uterine relaxants. So in case of premature labor, in case of habitual abortion, or in case of threatened abortion, अभी term नहीं आया है, term पूरा नहीं हुआ pregnancy का, but the contractions have started, there are chances of abortion. उस case में beta-2 adrenergic agonists like ritodrine and isoxaprine, they are used. Then we have other drugs as calcium channel blockers which can be used as relaxants. They are nifedipine. Again, these are the drugs which are used for uterine relaxation. And how they are used? Because they are calcium channel blockers, so they impair the entry of calcium ions into the myometrial cells. और जब calcium नहीं होगा, so what will happen? There is no contraction and it causes relaxation of the uterus. But the major side effect of these drugs, they are, that is the hypotension, and it can also lead to tachycardia. Then another miscellaneous drug is magnesium sulfate. which can be used. It is a miscellaneous drug. We can classify it as miscellaneous drug, and it generally reduces the blood pressure whenever there is a toxemia of pregnancy, जहाँ पर water level हो गया है, बहुत ज़्यादा BP बढ़ रहा है, वहाँ पर this drug could be used. So preeclampsia, higher blood pressure जब हो जाता है pregnancy में, seizures आने लगते हैं, वहाँ पर magnesium sulfate could be used, and only used जहाँ पर हम beta adrenergic drugs को use नहीं कर सकते, only in those cases magnesium sulfate should be used. So it could be life threatening, it can lead to respiratory depression, and if used in higher doses can lead to cardiac arrest. Then there are certain synthesis inhibitors, indomethacin, oxytocin receptor antagonist, जो कि directly oxytocin के receptor को antagonize करता है, block करता है. Fine. So that was all about the drugs which act on the uterus, uterine relaxants and the uterine stimulants. Thank you. Have a nice day.